Hi, everybody. Welcome. This is therapy part two. Let's get started on cognitive therapy. Now, if you understand the word cognitive or the word cognition, then the word cognitive therapy defines itself. Cognitive means thinking. So, cognitive therapy is about changing the way that you think. So, in therapy, the therapist focuses on changing or fixing the maladaptive thoughts of the patient. Okay. And so, cognitive therapy can be confrontational. It definitely focuses on the present, it doesn't focus on the past so much. So, when you're seeing a cognitive therapist, don't expect to get into too much of your mommy issues or anything like that. Now, maybe that's what you need. I don't know. But cognitive therapy, they say that the cause of mental illness is that you're being irrational, that your expectations are too high, your thoughts are the cause of your problems. So here's the perspective, and I wrote this, but I think it's good. We are depressed because we are irrational. Our expectations are too high and misplaced. We want everyone to love us and accept us. We want everything to go our way. We stay angry about stuff that happened a long time ago. We must change the way we think in order to be happy and successful. I'll give you an example. So, let's say you and I are having a conversation, and I say, "Oh, I'm depressed." Well, why are you depressed? Well, I broke up with my girlfriend. Oh, I'm sorry. When did you break up with your girlfriend? 5 years ago. You see that? So here's the deal. It's like if I'm sitting there holding on to something that happened 5 years ago, then it's my thoughts that are causing my depression. Okay. So names are not that important in the class, but Aaron Beck and Albert Ellis are very famous names for cognitive therapy. Aaron Beck is very famous for, and I'll show you something that you need to be familiar with in a second. Aaron Beck was interesting. He even tried to treat schizophrenia with cognitive therapy. I mean, imagine talking about how your delusions or your hallucinations are irrational. This is on the list of things you need to know. Aaron Beck's cognitive triad: how your thoughts, cognition, can affect your behaviors, but it can also affect your. You notice the arrows go both ways. Your thoughts affect your behaviors, and your thoughts also affect your feelings. And then your feelings affect your thoughts, and your feelings affect your behaviors. The arrows go both ways on all three: feelings, behaviors, and thoughts. Cognitive therapy is about changing your thoughts, and that's going to affect your behaviors and your feelings. Okay? Behavioral therapy starts here. Anyway, all right, moving right along. Okay, so here are some example of, now then there's a guy named Albert Ellis, and he had a list of common irrational ideas. Now, so let's take a look at these. I absolutely must have sincere love and approval almost all the time from all the significant people in my life. If you believe that, then you are going to be depressed. I mean, that's just the truth. Also, I must be thoroughly competent, adequate, and achieving in all respects. Or I must have at least real competence or talent at something important. Otherwise, I am worthless. That is not true. That is irrational. You don't have to be good at anything. I mean, really. I mean, if you think about it. And another one at the bottom: people who harm me or do a bad thing are uniformly bad or wicked individuals, and I should severely blame, damn, and punish them for their sins and misdeeds. If you believe that, then you're going to have a hard time. And you need a cognitive therapist to help you to change that thinking. Okay? When things do not go the way I would like for them to go, life is awful, terrible, horrible, or catastrophic. Yeah, if you think that, you're going to have a problem. Okay? So remember, these are your thoughts that are causing you to have depression, and you have to change the way that you think. So there is a term called cognitive behavioral therapy that you want to be vaguely familiar with, but your thoughts can affect your behaviors and your feelings. This is bad, but after here, this is um, notice how you change your thoughts from I am not a good person into I am a good person, and then everything else seems to go along with that. Okay. So, in summary, what causes mental disorders? Irrational thoughts and irrational beliefs. How do you treat disorders? Change the thoughts, change the beliefs with cognitive therapy or cognitive behavioral therapy. Okay? All right, so let's try some questions. The answer is cognitive therapy. Because when you talk about interpret, you're talking about thinking. Change the thoughts, change everything else. All right. Roxy is anxious because she believes that nearly everyone must approve of everything she does. Which of the following is a cognitive therapist most likely to do to help Roxy overcome her anxiety? Make sure your answer comes from a cognitive therapist, not from a behavioral or a psychoanalytic therapist. The answer is, let's see, interprets, thinks. Change the way you interpret. That's thinking. All right. Which of the following psychological theories would explain post traumatic stress disorder as being the result of irrational beliefs and ideas? The answer is, all right, moving right along. According to rational emotive behavior therapist, cognitive therapist, the source of much happiness is the individual's what? All right, the answer is so rational emotive behavior therapists think of it as cognitive therapy, cognitive perspective. The answer is D. Beliefs, thoughts, beliefs. And these questions just keep going on and on. The role of a therapist in cognitive therapy is to identify a client's irrational beliefs and provide alternative ways of believing. Yeah, the questions just keep coming and keep coming and keep coming. All right. Eclectic therapy, just so you know, most therapists today use a variety of tools from the cognitive perspective and from the behavioral perspective and from the humanistic perspectives. Okay, they don't dabble in psychoanalysis, but most therapists do dabble in cognitive, they dabble in behavioral, and they dabble in humanistic perspectives. So they do a little bit of each. That's what we mean by eclectic therapy. Okay. All right, moving right along. Group therapy. Group therapy is very common because it serves a very good role in modern psychotherapy. I want to talk to you about the you may even want to write these down. These are the benefits of group therapy. It's cheap and it's effective. Why is it cheap? Because you can have like 20 people in the room but only one paid therapist. That means it's going to be cheaper. Also, it allows people to gain insight into their own behaviors and thoughts. Because here's the deal, when you're listening to other people who have the same issues you do talk, you get insight. You don't feel alone. And that's the third one. But when you hear other people talk about dealing with the same crap you're dealing with, and it's not a therapist, but it's a patient, it does help you to gain insight. Okay. All right. So do this question. An advantage of group therapy over individual therapy is that group therapy, the answer is B, enables clients to realize that their problems are not unique. So when you hear other people struggling with the same thing you do, it makes you feel like, wow, I'm not the only one. Here's another one. All of the following are potential benefits of group therapy, except for. So your answer is not a true statement. And the answer is B. You still need a professional for it to be group therapy. So B is not a true statement. All right. So let's talk about biomedical treatment. I believe it's called biological nowadays. When you talk about the biological perspective, you're talking about medicine, surgery, and when ECT, that doesn't mean etc. That means electroconvulsive therapy. So we're talking about the biological perspective now. We're done with the cognitive perspective. Okay, you pretty much need to know all this stuff, but I understand if you've already learned it or you already know it. So this is what you need to know for the AP exam. If you have schizophrenia, it needs to be treated with antipsychotic medication. Now, two things I want you to know about antipsychotic medication: it decreases dopamine. Okay, I probably shouldn't even put that small font. That's important. You need to know that it messes with your dopamine levels. When you have schizophrenia, that's the disease where you have hallucinations and delusions. It's caused by having too much dopamine. So antipsychotics will reduce your dopamine levels. Also, it'll lead to what's called tardive dyskinesia, which is a side effect. Tremors is what it is. Dopamine controls bodily movement. So when you're low on dopamine, when you reduce your dopamine levels, you may get tremors. Antidepressant medications such as SSRIs like Prozac and Zoloft, they mess with your serotonin levels. The second S stands for serotonin. Anti-anxiety medications increase GABA. GABA chills you out. So Xanax and Valium will increase GABA. Drinking alcohol will increase GABA. And then we have lithium, which is the treatment for bipolar. It's a mood stabilizer. All right, moving right along. I know that's a lot, but I've covered some of that in earlier chapters. Tardive dyskinesia are tremors. They are side effects of antipsychotic medication. So if you're taking antipsychotics and you're getting tremors, that's called tardive dyskinesia. SSRIs are antidepressants. I don't want to get into this too much, but SSRIs, they mess with your serotonin levels. Think of the yellow balls as serotonin. So basically, they increase serotonin in the neurons. I don't want to get into it any more than that. Okay. Deinstitutionalization. This is on the list of things I'm supposed to teach you, and it's true. Over the last 50 years or so, our medications have gotten so good. I'll just read this to you. Due to the increased use and effectiveness of psychotropic medication therapy, hospitals and asylum deinstitutionalized massive numbers of people in the late 20th century. What that means is um, no more staying in mental hospitals for years and years and years. The medicines are so good, they just send you home now. Not everybody, okay, but most people. So you don't have a whole lot of asylums on every corner anymore. Now they just send you home with pills and let somebody else take care of you. That's what we mean by deinstitutionalization. So nowadays, you have medicines you take every day, and you might have a therapy session every week. You might have two. You might have group therapy and a one-on-one therapy with your therapist. Okay, that's deinstitutionalization. All right, do this one. You're probably, I don't think I taught you this one good enough. Um, Serotonin more available. If you're going to guess it at all, it would have been from that phrase right there. Don't worry about this one. Okay. Carmen's psychiatrist has prescribed a selective serotonin reuptake inhibitor, serotonin, to help Carmen feel better. Carmen has most likely been diagnosed with what disorder? All right, the answer is depression. Depression. Okay. All right, moving right along. Because an SSRI is an antidepressant. All right, a medication that primarily enhances the activity of GABA in the brain would likely be used for the treatment of which disorder? All right, so the answer is anxiety. So if you're taking Valium or Xanax, that's going to increase GABA. Okay, yeah, increasing the level of serotonin. I didn't teach you that good enough, so I'm zooming through that one. All right, so in addition to medicine, the biological perspective also has a couple of brain stimulation therapies. I have seen electroconvulsive therapy on the test a few times. I have not seen TMS before, but I'm going to teach it to you anyway because it is on the list. All right, electroconvulsive therapy. It's used to treat depression. It does have a side effect of memory loss. I'm going to show you a video, but what I do know about electroconvulsive therapy is this. It does work, but it's very expensive.
Last year, 13% of adolescents suffered a major depressive episode. About 5% of adults did as well. Now, it can be tough to find the right combination of medications, but now experts say there's another treatment that is far more effective. As we continue our Be Mindful series, our Sherman Chow takes a look at electroconvulsive therapy.
I don't want to live. And I thought, I don't want to live. And then I thought, who's going to take care of my children?
So Carol Kevlar planned to kill her entire family.
What?
At 40, she had her first psychotic break. After 24 days in a mental hospital, doctors prescribed ECT, or electroconvulsive therapy. In just 3 treatments, her husband said she was coming back.
Tears running down his eyes.
Modern ECT has come a long way thanks to lower dosages, anesthesia, and a paralytic agent.
It decreases a lot of the anxiety and mental trauma because you've slept through it, as well as the potential for physical trauma because you've been paralyzed through it.
Dr. Neil Puri is director of the Brain Stimulation Center at Houston's Menninger Clinic. Only the ankle is not paralyzed, helping doctors monitor the seizure, along with an EEG, which reads the brain's electrical activity. Each treatment or shock lasts under 10 seconds, and typically 1 course of ECT means up to 12 treatments over a month. And just 2 weeks or so after that,
So it remains one of the most effective treatments for any condition, but especially for depression. They get better rapidly.
That's interesting. So, more effective than many of the standard prescription drugs?
Correct. Yeah, we're seeing remission rates between 70 to 90% for ECT.
Wow. Okay, so that is very dramatic.
so why do these induced seizures work? Seizures may help rewire the brain. Other theories?
We release a lot of the good neurotransmitters that help depression. And in depression, we may have areas of our brain that are gotten smaller, and the seizure can help those areas regrow.
Nurse Lauren Spring preps then monitors the patients in recovery.
Sometimes in as little as 2 to 3 treatments, it's like I've met that person for the first time.
Carol had 3 more psychotic breaks in the next 10 years. And between those, she had some very good years.
I have spent 100 days in psych hospitals and have had just over 50 shock treatments.
She does have some long-term memory loss. Short-term memory was back to normal pretty quickly. The last time she had an ECT, 19 years ago.
ECT is definitely my silver bullet. It gave me back my life.
Standing for Houston, Shermin Chow, KHOU.
Wow. Okay, that girl had some problems. Okay, now here's a video on TMS, transcranial magnetic stimulation.
Each year, Americans spend more than $11 billion on antidepressants, but studies show they can be ineffective in up to 40% of all patients. Bob Holmes was one of them.
They tried to adjust my medication, but the medication had side effects that were undesirable.
Holmes is among the 16 million people in the U.S. who suffer major depressive episodes each year, a number that has increased 18% over the last decade, which is why some doctors at UCLA Health are taking a different approach. Here, doctors are beaming magnetic pulses deep inside patients' brains to change the way depression symptoms are perceived.
We are used to thinking of the brain as a chemical organ, but it's also an electrical organ. The idea that by using non-chemical means we can change the brain and how it functions.
It's called transcranial magnetic stimulation, or TMS. It's currently FDA approved only to treat depression, but doctors say it may prove helpful in a wide range of conditions by rewiring a network of signals in the brain.
What TMS is doing is changing how that network functions, really rebooting the network to improve symptoms of mood, anxiety, and chronic pain.
Which may be why many patients treated for depression also say it helps relieve their pain, raising provocative questions about whether TMS could one day become a viable alternative to opioids.
This is a really transformative kind of therapy.
All right, I hope that's good enough, but that is transcranial magnetic stimulation. I have not seen any multiple choice on TMS. All right, so let's try some questions. Okay, research on ECT has shown that it's most effective for treating which of the following disorders? The answer is depression. It may be used for treating other things, but that's not what you're going to see on the test. Okay. All right. So years ago, like back in the 40s and the 30s and the 50s, they had a lobotomy. Lobotomy does not happen anymore. That we have, our pills are too good for that, but they would stick like an ice pick up your eyelid, damage your prefrontal cortex, get rid of your anxiety that way. But nobody does that anymore. We've got pills for that. We've got too many good medications for that. But that's an old example of a surgery that we just don't do anymore. Okay. Again, I don't want to, let's move on. Okay. All right. So psychotherapist who believes that deviant behavior can be traced either to genetic anomalies or problems to the physical structure of the brain. The answer is that's the biological perspective. Okay. Psychoanalytic is about the unconscious. Behavioral is about the environment. Cognitive is your irrational thoughts. All right. Which of the following treatments assumes a biological cause for a disorder? The answer is ECT, because it assumes that it's chemical or electrical is why you're depressed. All right, read that. Okay, so I haven't taught you this yet. Here's a word, non-malfic. I don't even know if I'm saying it right. Mal means bad. This word basically means do no harm. So this is an ethics question. So the answer is C, protecting them from physical and psychological harm. So this word means do no harm. That's what it means. Okay. All right. According to the APA, the American Psychological Association, psychotherapists must practice non-malfeasance, do no harm. Fidelity means to be honest and develop trust with the patient, and integrity and respect. That also means respect people's cultures. Okay. All right, that is it. Thank you very much.